Tell me about 988.
Absolutely. So we want to talk a little bit about 988. So 988 it's an easy to remember number, right? 3 numbers, 988. And it's for anybody who could be facing a mental health crisis or maybe some emotional distress. If you're feeling overwhelmed, depressed, even thinking about suicide, that number is there and it connects you to a trained counselor who can help you, who can talk to you. You can call 988, you can text 988. It's free, it's confidential, and it's 24/7. It's 7 days a week. So that number is always there for folks who need a little bit of help.
That's interesting. You said text as well.
Absolutely. Yeah, you can text. They also have a website, 988lifeline.org.
Okay.
You can go on their website and use their chat feature too.
Okay, sounds good. Oh, about how is 988 different than 911 or some of these other crisis lines?
So 911 is for medical calls and emergent calls. If someone has taken active steps to hurt themselves, that's when you do a 911 call. But 988 is to de-escalate the situation. 988 is there for when life is hard.
Okay, that sounds good. Tell us some of the stories that have happened at the 988 line.
Absolutely. We've placed 988 information on ambulances, which a lot of the listeners may have seen, also providing a resource brochure to the EMS staff so that they can address some of those non-emergent needs that they may come across, connecting folks with resources and providing training to EMS so that they're aware of a lot of the resources and things that we may offer as an agency. We are also excited to share that there is a survey coming. We've pushed a lot of 988 media out this month and last, and so we want to see, was it really helpful to folks and what was the impact for them? So we're really excited to hear folks' input and encourage you to look out for that survey.
Alrighty, what kind of situations should someone contact 988 for?
A few examples are things like job stresses, finance worries, or relationship stress.
Okay, what happens when they call 988? What's the next step?
Well, like Dylan said, it connects you to a trained counselor. They're crisis counselors. They're people who have been trained to listen, to help. They're real people, not robots. These counselors are trained to handle mental health and substance use issues. They know how to talk to people who may be overwhelmed, anxious, depressed, or even thinking about suicide.
Okay, well, how are we spreading the word? Obviously, we're here on the air.
Absolutely, yeah. So you remember 30 years ago when 911 came out, right? There was a lot of education around it, when to use it, when not to use it. Mm-hmm. So Haywood Health and Human Services has kind of been doing the same thing for 988. We've been having different meetings with civic and community groups. We've been going into our schools and talking to students, having meetings with first responders. We're putting our information, like Megan said, out on billboards and on the newspapers and on social media, on radio. We've got stickers that explain what 988 is on almost all of our county vehicles, including ambulances. And, we're always looking for that next opportunity, just anything we can do to raise awareness.
Well, how can some of the folks in the area support the mental, help support this effort of 988?
Absolutely. I think first, and foremost and most importantly is just talk about it, right? Talk about 988, talk about mental health. Make sure that people know that number is there for them anytime they need it, 24 hours a day, 7 days a week. And Haywood Health and Human Services is happy to come out and speak with community groups who want to get involved, who want to educate people to kind of talk about what it is and why it is so important.
Okay, so what's next for 988? We've got something that's coming up next. Obviously, this is a big project.
Yes. One of our big things about it is continuing to educate the community, and we're trying to break this stigma about mental health. We're trying to make sure that people know that there's help for them if they need it. There's, as Dylan and Megan have said, there's a lot of things that are out this month because it's Mental Health Month, and we're just trying to get the word out and break that stigma.
All right. Well, if somebody wants to get involved, what's the best thing they can do?
There are several things we'd like to point out. They can start by sharing the 988 number with their family, friends, people they work with, and just helping to spread the word about that can save someone's life. You can also check in on the people around you. Just having a quick conversation or a kind word can really go a long way when somebody's struggling. And also to support the local organizations providing mental health services, whether you donate, volunteer, or just helping to raise awareness.
All righty, what else do we need to talk about, folks?
I think that's all. I think it's just so important that we get the word out and let people know, right, that that 988 is there for them when they need it.
Okay, this is like a 911, but it's not a crisis 911. This is to help de-escalate situations and want to get involved with that. Do they have information if you did call 911 on how they can get involved?
Yes, they do. All of our dispatchers in Haywood County have the same brochure that go out on our ambulances that have resources and can direct them to 988 or local resources if they need them.